gathered here today. We have a meeting to discuss the future of St. Luke's. We have the support of our community, the nurses of St. Luke's, other nurses in support of St. Luke's, and the travesty of what the city or CPMC is trying to do with St. Luke's. There's been a proposed closure of our NICU and PEDS unit and continued erosion of our services and staffing. Thank you, community, for showing up. I'll give you first our first speaker, Assemblyman Mark Leno.
Thank you, Jane, and thank you all for being here today. And I want to reiterate once again, I stand with my nurses always, and we will not let St. Luke's be closed. Sutter claims it cannot afford to keep St. Luke's open, that they could have just let it die its own death. That's not the case. Sutter Health is making huge profits here in San Francisco, hundreds of millions of dollars, and St. Luke's cannot be sacrificed.
I say to Sutter, keep your hands off St. Luke's. This is more than a local issue. This is a populist issue. This is about who gets health care. Because St. Luke's is in a neighborhood that's disadvantaged, doesn't allow you to take advantage of that and make moves to close down this hospital. It is not gonna happen. I promise you, if we have to take possession of that hospital, if we have to sleep and eat in that hospital, we will do that, and I will join you.
We need to fight to keep our emergency rooms open because minutes matter. Life and death situations occur in our emergency rooms, and it will disadvantage residents on that side of town to have to go all the way across town to get the services that they need. Thank you all for being here. Let's continue the fight.
It's clear that St. Luke's is truly a community hospital that serves the neighborhood around it. People need to be able to go to that hospital without concern about having a car or paying for transportation, but need to be able to get to that ER and get to that hospital immediately. There's another significant thing that the Board of Supervisors, City Hall needs to understand, and that all of San Francisco needs to understand, and that is when you close beds, when you decrease services, you decrease the capacity of our medical system in the city to take care of emergency situations. Whether that's a bus accident, whether that's a hurricane, an earthquake, or a fire, we need to have the capacity not just to take care of patients every day, but to take care of patients on those days where the needs is more than we could have anticipated. Thank you.